Welcome again to the second day of the Lancet Palestinian Health Alliance conference in its 11th meeting. We are now in session 7, dedicated to environmental health research. My name is Rima Habib, and I will be the moderator of this session. Our first speaker in this session is Dr. Mahmoud Radwan. Dr. Radwan has a PhD in health policy and management and has been working at the Palestinian Ministry of Health since 2001. Between October 2018 to October 2020, he has worked as a public health officer at the Palestinian National Institute of Public Health, World Health Organization. Dr. Radwan has more than 20 publications in international peer-reviewed journals and has participated in different international and national conferences. He has been working as an academic supervisor and external referee for many master's students. Dr. Radwan is speaking today on morbidity and mortality of road traffic accidents in Gaza, Palestine, using a capture-recapture statistical model. Dr. Radwan, the floor is yours. Please start your presentation.
Bismillah ar-Rahman ar-Rahim. This is Dr. Mahmoud Radwan, a PhD in Health Policy and Management. I was working at the Palestinian National Institute of Public Health, and now I am working at the Ministry of Health, Gaza. My topic is morbidity and mortality of road traffic accidents in Gaza, Palestine, using capture-recapture statistical method. I will start with a small introduction. As you know that according to the WHO Global Status Report on Road Safety, the road traffic injuries are the 8th leading cause of death for all age group and the leading cause of death among children and young adults aged from 5 to 29 years. WHO estimates that the global number of road traffic deaths was more than 1.3 million in 2016, where about 93% of all deaths occurred in low and middle income countries. Even though these countries have about 60% of the world motor vehicle. These figures suggest that the world is far from meeting the Sustainable Development Goals target 3.6 that calls for 50% reduction in the number of road traffic deaths by 2020. Moreover, it can be said that in low middle income countries, the road traffic injuries are commonly underreported. And this study aims at to estimate the incidence of road traffic injuries and fatalities using the capture-recapture method. What is capture-recapture method? Capture-recapture method is used to address the underreporting and improve the accuracy of disease estimate by using 2 or more independent data sources on the same event. This method has been used in various studies to estimate the prevalence of cancer, prevalence of diabetes mellitus, prevalence of stroke, TB, HIV, road traffic accident, and other diseases. The methodology. In Gaza here, the road traffic injuries are primarily obtained from police records and Ministry of Health hospital records, where the data of these 2 main sources are linked to through a web-based e-registry. All registered data from the 1st of January to the end of December during 2018 were analyzed. The ID number was used as a matching procedure to find records from both data sources corresponding to the same individual and to the same crash event. Chapman formula of capture-recapture was used to estimate the number of victims and deaths. And this is the formula of Chapman. In this formula, R1 is the numbers of victims or deaths registered in hospitals records. R2 is the numbers of victims or deaths registered in police records. R is the number of victims or deaths identified in both sources using the ID number. The variance of this estimate was calculated to obtain 95% confidence interval using this formula. The result. This slide shows the stratification estimate of the injuries. If you look to this number, 1,722, this number is the number of injured person which was recorded in the Ministry of Health. And this number, 1,356, is the number of road traffic accident or injured person is registered in the police records or police registry. This number, 970, is the number which has been registered in both sources, in the Ministry of Health and the police. And we catch it by the ID number. So this number, 970, is the match number between both sources. This number, 2,407, is the number of road victims as estimated by the Chapman capture-recapture method, which is 2,407 with a confidence interval from 2,354 to 2,460. And by this capture-recapture method, it shows that the Ministry of Health records captured 71% of these victims and the police records captured only 57%. Also, this slide shows the classification of injuries according to the gender and age. The slide shows that, or the analysis shows that the majority of victims from both sources are more likely to be male. Meanwhile, about 40% were less than 15 years old, and also 40% were in the age group of 15 up to 35 years old in both data sources. This slide also shows the classification of injuries according to injury type and vehicle involved. Both sources showed that the vast majority of victims, more than 90%, were with non-serious injuries, either slight or with moderate injuries. And most of the victims from both sources were using four-wheeled vehicles, for example, car, small van, heavy truck, bus, etc. This slide shows the stratification estimate of the deaths. The Ministry of Health during 2018 recorded 16 cases of the RTA, 16 deaths, I mean. In the same year, the police records or registry recorded 57 deaths. And this number 14 deaths is represent the matched number between both sources. So 14 deaths were registered in police records and Ministry of Health records. This number 65 is the estimated number of the real deaths, which is the total number of fatalities estimated by capture-recapture method, which is 65 deaths with a 95% confidence interval range between 55 and 74. And the capture-recapture was able to show that the Ministry of Health records captured only 25% of these fatalities, whereas the police records capture 88%. In general, it can be said that the police records reported a quite higher number of deaths, as such trauma is considered as judicial and legal issue. So the police also they follow these deaths. However, this result is consistent with the finding from low-income countries show that the traffic police data are more reliable for fatal injuries than the hospital data. Okay. Also, this slide can show the classification or stratification of deaths according to the gender and age. Both of sources shows that the most of deaths were male, and more than half of the fatalities were less than 15 years old in both sources, and the vast overwhelming majority were using also four-wheeled vehicles. Okay, this slide talks about capture-recapture versus WHO estimate. So we have estimate by WHO and we have estimate by capture-recapture. The population of Gaza Strip during 2018 was about 2 million. The incidence estimate for road fatalities was 3.4 per 100,000 population for Gaza Strip. This is estimation. This is according to the estimation by capture-recapture. But according to the WHO estimation, the incidence estimate for road fatality was 5.3 per 100,000 population. This is for West Bank and Gaza Strip. I couldn't analyze the data from West Bank during 2018 as the e-registry between police and Ministry of Health in West Bank was not well established at that year. So it can be said that the difference from our estimate, I mean capture-recapture, this can be probably be explained by the fact that our study was performed only in Gaza Strip. So applying the capture-recapture on the traffic data in the West Bank and Gaza together might provide a comparable estimate with the WHO method. Noting that the WHO uses different adjustment, which is a negative binary regression model to account for the potential underreporting. Conclusion: despite the methodological basis of the capture-recapture, it seems that it might be a powerful tool to estimate the incidence of road traffic victims and deaths, where such estimates are incomplete and under-reported. So also neither the Ministry of Health, according to our analysis, neither the Ministry of Health nor the police registries independently provided accurate or complete figures on the incidence of road traffic injuries and deaths. So it can be recommended that strengthening the Ministry of Health and Police registry is crucial to obtain accurate and reliable information on crash circumstances, injury patterns, road users, vehicle involved, and all behavioral risk factors that are required to formulate appropriate road safety policies. In addition to that, it can be recommended that using the ICD-10 codes is extremely recommended to address the current high missing and help in the classification of cause, manifestation, location, severity, and type of crash injury. Thank you so much for your listening.
So I was thanking Dr. Mahmoud for this very interesting study. And in this research, using the police and the Ministry of Health hospital records and linking the two databases or the two data from the two sources through a registry shows and emphasizes the importance of registries for such research. Package of the two, that of the police records and that of the hospital records, and also identified ways to strengthen both registries. Having these results is extremely important to provide directions for policy. For instance, learning that more than half of the fatalities were less than 15-year-old, and that the vast majority of injuries were injured by four-wheel vehicles are important findings on road users and vehicles involved and are required to formulate appropriate road safety policies. Before I open the floor to questions and discussion, I would like to ask Dr. Mahmoud myself about his finding and to contextualize the finding on the numbers of girls and boys, because more than 15 girls, about double the number of girls were double the number of girls exactly. The boys were more than double the number of girls involved in injuries, road accidents. Could you comment on this? Is it probably girls are less in cars in the local context, or boys probably are taking more risks in this case? And the mere fact that you have more than double of those who were injured are below 15 years of age. Were they road users, or were they in the vehicles themselves? So they were passengers in the car. Could you please elaborate on this so we can contextualize the findings a little bit more? Thank you.
Are you hearing me? Hello?
Yes, we can hear you. Go ahead.
Yes, thank you for your question. Actually, despite the missing of some data, but what I have from these data, I try to analyze what I have. But according to my humble opinion, I can say that here in Gaza, the context is a little bit different from maybe in other countries. So we can find the boys or the male, or the boys, they have higher percentage to be to expose for this RT accident. Here in Gaza, the boys, it can be said that they go to the street more even than the girls. Here we use that we have in our families here in Gaza, according to our context or maybe tradition or something. The girls used to stay more here in their houses, but this is different from the boys. The boys, you can find the boys more in the street, so they can to expose more for this accident. The second point I can explain that by the boys here in Gaza, they use the bicycles itself, or sometimes they use the street, or they use the bicycle in the street. And the four-wheel vehicle can target them, or they can be injured by the vehicles more than the girls. Have I answered your question, or you need hello? Hello?
Yes, thank you very much, Dr. Mahmoud, for this clarification. Thank you very much. I'd like now to open the floor for questions and discussion. You could either type your question in the chat box, or you could just unmute yourself and ask the question, please, directly to Dr. Mahmoud.
John Yudkin from London, can you hear me?
Yes, John, we can hear you.
I have my hand up as well. Dr. Mahmoud, it's an excellent presentation and a fascinating methodology. I think that one of the things that becomes apparent from the answer to your previous question, is you don't have any records in the slides you showed us, but I'm sure you will have, of whether the victims were the drivers or the passengers of the vehicle, or were pedestrians who were hit by a vehicle. That would be very interesting. The other thing that I want to query is, if you look at the age, sex breakdown and the completeness of recording of hospital data versus police data, there are much greater proportions of the total that the police get right if somebody has died than just for injuries. But when you look at the age sex breakdown of that, I'm curious that the 25 to 35-year-old men, the police data is an under estimate of the total number of deaths in that sex and age group. And I just wonder if, when somebody has been killed in a road traffic accident and the police record it, and there's some question as to whether it was a road traffic accident or suicide or murder, whether the police may have picked up those deaths but put it in a different category. Is there any way one can interrogate that data and see what the details of the people who've been picked up by hospital records but not registered by the police, what are their characteristics? Do you see what I'm saying?
Dr. Mahmoud?
Yes, Dr. John. Actually, as I mentioned, when I started to analyze the data, unfortunately, many of these data was missing. But as I mentioned in the slide, it can be said that the police data, we're recording more, even more data or information about the crash event, rather than the Ministry of Health, even also particularly for the deaths. You know, the police here in Gaza or in Palestine in general, they follow the deaths or even the injured cases. They follow them until they are recovered, or even until they died, because this is related to something judicial or something legal issue, so they can follow. And also, as I mentioned, I cannot actually analyze the type of injury or who are the road user, even either the pedestrian or the driver. This was very difficult, because neither the Ministry of Health nor even the police, they were not recording all the cases or classify who are the road user.
Thank you, Dr. Mahmoud. John, are you satisfied, or do you have a follow-up question?
No, that's very helpful. Thank you very much.
Thank you. Any other questions? I cannot see both the chats and the hand raise. So please speak up if you have a question. Otherwise, we will move on.
Yeah, it's Harry Shannon here from Canada. For the fatalities, I wonder if you have access to death records. That would be another way to check on the completeness of your information.
So another data source, Harry, you're suggesting a third register.
Yes, there might be all sorts of confidentiality issues, but that would be another source for the, obviously it would only apply to fatalities.
Yes, actually, yes, Dr. Harry, thank you for this question. Actually, you are right. Even the capture method, it recommends using either 2 or more data sources. I use just only the Ministry of Health and the police record, and some countries they use even third data source. For example, the insurance company. Referring to your question about this certificate, yes, actually I couldn't go back to this certificate because I used only the electronic, the available data, which is in the Ministry of Health and the police records. So I only analyze what I have from what have been entered data in this e-registry. But I guess your advice is very important. So going back to this certificate can make, better estimation. So at the end, each methodology has its own limitation or like this. And thank you so much for your question.
Thank you. Thank you very much, Dr. Mahmoud, for a very interesting study on a very important topic. In the context of Gaza, one would think that there are also other priorities to study, especially with volatile political context. But for you to focus on something as important as this, road traffic accidents and casualties and injuries, you are highly commended for doing that. Thank you very much.
Thank you so much.
Thank you. Now we are going to move on, and our second speaker is Dr. Maysa Nimr, an assistant professor at the Institute of Community and Public Health at Beirut University, Palestine. She holds a PhD in occupational epidemiology from the University of Oslo. Her research interest is focused on occupational epidemiology, environmental health, and social, political, and economic aspects of occupational and environmental health, with special interest on working women's health. Dr. Nimr is speaking today on the health of female farmers in the Jordan Valley, in exploration of the effects of broader environmental transformations. Dr. Nimr, the floor is yours. Please start.
Hello, everyone. My name is Maysa Nimr. I am an assistant professor at the Institute of Community and Public Health, and the title of my presentation is Health of Female Farmers in the Jordan Valley, an exploration of the effects of broader environmental transformations. This presentation includes the findings of part of a larger research project that was conducted in the Jordan Valley together with my colleagues listed below. The Jordan Valley is a major agricultural location in the occupied Palestinian territory and has been the main source of a variety of crops that are used all over the West Bank. The area of the Jordan Valley is characterized by geopolitical, economic, and demographic characteristics that distinguish it from other regions in the occupied Palestinian territory. It stretches from Ain Gedi in the south to the Bardala area in the north, and accounts for about a quarter of the West Bank. There are about 63,000 Palestinians living there and distributed in 30 communities and a group of small villages. Palestinians in the Jordan Valley live in poverty, in constant fear of house demolitions, have restricted movement, limited access to healthcare and education, and constraints on maintaining viable agricultural livelihoods. Palestinian women in the Jordan Valley have been involved in agricultural activities at their own and family farms, where they are used to perform various agricultural tasks. Generally, women tend to work in agriculture in order to economically support the family, to reduce family poverty levels, and because of low other job opportunities elsewhere. Several political and press reports have described living conditions in the Jordan Valley, but none included gender-related issues. And as working women are among the most vulnerable groups in the population, this study focuses on providing an understanding of the situation of women working in agriculture in the Jordan Valley in the context of broader environmental transformations. So, the aim of this study is to investigate the changes in agricultural sector in the Jordan Valley and how these changes affected the farming women's working conditions, their living conditions, and the effects on their health. Given our broad definition of the environment, the study will identify and highlight the environmental, political, and socioeconomic factors and the interactions among these factors which could have led to changes in the living and working conditions of these women and their health. In order to achieve our aim, we utilized a qualitative approach in which we conducted interviews with 30 women and 2 focus groups with 20 women. The study was carried out from June to December 2019. Participants were selected using purposive and snowballing sampling. The study was conducted in 2 Jordan Valley communities, Jiftlik and Nu'aym Duke. We selected these communities based on the distinctions between Nu'aym Duke and from the village of Jiftlik in a number of geographical, political, and social characteristics, which will provide good potential for comparison of the possible different factors associated with the political and social transformations. Going to the findings of the study, and because of the time limits of this presentation, I will be focusing on the most important findings. 3 main themes emerge from the data on the roles of women working in agriculture and their living and health conditions, which are as follows. The first theme is gender division of labor and agricultural technological development. The data showed a clear gender division of labor, which depended on several factors related to the presence of men in the farm and also to the level of agricultural technology. The pattern of agricultural production in the Jordan Valley before the 1970s depended on women and men working together, and traditional agricultural methods have been used, including irrigation by means of channels, which was called dawalib. This method included intensification of agricultural work throughout the period of agricultural production in terms of large area preparations using traditional and simple methods without machinery and also the massive growth of weeds. At that stage, there was a clear gender division of labor in which men's tasks were preparing the land using the agricultural tools, spraying pesticides, and marketing, while women's tasks were planting, weeding, and harvesting. There was sometimes an overlap in the tasks depending on the availability of family labor and the presence of men next to women in the family. In the late 70s and early 80s, agricultural technology was introduced, which included the drip irrigation system. In addition, new types of fertilizers and pesticides, improved seeds suitable for the new irrigation system, greenhouses, and agricultural machinery were all introduced. The cost and the volume of production increased around 5 times. At the same time, there was an increase in the marketing opportunities during that period. They had many marketing opportunities in the local land, in the Israeli lands, and also in the neighboring Arab countries. The use of agricultural machinery reduces the time and effort required to prepare the land for cultivation, which were mainly the men's tasks, but the increased production led to an increase in the effort required to harvest the crops, as well as the planting phase, which were women's tasks. So the burden of women farmers increased at a time when there is less family labor, in addition to carrying out household chores on their own without the help of men, which included taking care of children, sometimes taking the children to the field, in addition to other household activities. Agriculture after the 1990s has faced many changes, which mainly happened after the Oslo Accords, and this period was characterized by more technology and less economic benefit. At that period, new varieties of hybrid seeds and seedlings were introduced that increased the production quantities, which was known as the vertical expansion. And this was associated with new types of pesticides and chemical fertilizers with very high prices. Marketing lines have become weak and politically insecure, especially after the Oslo Accords, and there was no internal protection for marketing in addition to the introduction of imported special Israeli items, which has affected the marketing of the local products. At the same time, the costs of agricultural equipment, basic materials such as plastic, seeds, pesticides, and so on, and the cost of life doubled. The farmers had accumulated debt, and the economic benefit from agriculture highly declined. Farmers also faced the problem of lack of water due to Israeli control in Al-Jiftlek or because of the governmental facilities in the Nu'ayma in general. Regarding the women's roles at that period and within all these changes, women kept on working in agriculture as they had no other choices and still were doing the heavy tasks of harvesting, where they needed to bend over or stand for long periods of time. The second theme that I will talk about is the social and economic aspects of women's lives. The different environmental and political factors have largely affected the social and economic aspects of the lives of women. Regarding the social aspects, the presence of men next to women had limited the role of women in making decisions. This was accompanied with very low level of education for both men and women, and also women had to do all the housework in addition to their major role in agriculture. Regarding the economic aspects, in family farming, men control the income of all family members. So women were mostly working unpaid as a way to help the family with very limited economic independence. And in the cases where women worked outside the family and having a paid job, they spent the cash income in improving the housing conditions, leaving no room for their personal needs. And for another theme that emerged was the variations in women's conditions. So the data has also revealed clear variations between women's conditions depending on the effects of these transformations. Many women, due to the decline in the economic benefit from the agriculture, had to migrate to other villages together with their families to work in agriculture. These migrant workers had more difficult conditions compared to the local workers. As the local workers had better housing conditions, social relations within the village, and also had a more sense of stability, while most of the migrant workers were living in tents and tin plate rooms within the farm and had limited social relationships with a sense of lack of stability. Regarding the workplace, being inside or outside the family, for some women, instead of migrating, they selected to leave the family farm and do a more paid work in Palestinian or even Israeli farms. There were also differences between those who stayed working within the family and the ones who left. The ones who stayed working within the family had limited interaction with others outside the family, in addition to limited economic independence and unpaid work, while the ones who went to work outside the family had more interaction with others, freedom of movement, and more control of income. Clear differences also appeared between women according to their place of living. So residents of Al-Jiflik, which is entirely classified as Area C land, and also the Area C parts in Nu'ayma and Duke, had poor infrastructure, poor and unsafe housing conditions, a constant threat of house demolition, a feeling of instability, and also difficult transportation and limited services. While the residents of Nu'ayma and Duke, Area A, had better infrastructure and housing conditions, in addition to more access to different services. And the last thing is the effects of living and working conditions on the health status of women. So most women reported that carrying heavy loads and continuous bending when harvesting and doing different tasks have caused musculoskeletal issues. Some women reported having health problems related to pesticide exposure, such as asthma, respiratory and skin allergies. Long working hours outdoors also caused issues related to dehydration, in addition to poor nutrition. To conclude, difficult living conditions, Israeli violations, together with occupational and environmental exposures and lack of occupational training and safety, have negatively affected women's health, with possibly adverse consequences for the well-being of their children and families who depend on them. This study raises important questions regarding the gendered experiences and effects of political and environmental transformations in the Jordan Valley on agricultural work and the well-being of agricultural workers. Unless more attention is given to those groups of working women, they will continue to experience difficult living conditions, low levels of social interactions, lack of proper employment, and adverse effects on their health. Thank you so much for listening.
Thank you. Thank you. Thank you, Dr. Maisa, for this very interesting presentation that underlines not only the environmental, but also social, economic, and political factors and their role in the living and working conditions and health of women farm workers. In fact, we rarely encounter studies on farm workers that go beyond the typical physical and ergonomic exposures and address the surrounding political context and its impacts on the health and well-being of the workers. I was fascinated to listen to your study addressing women farm workers' isolation and lack of social interactions as a result of the work conditions they had to pursue. Also, it's very paradoxical to learn that the workers who work hard to produce the food for people suffer from poor nutrition. It's very intriguing. I have 1,000,001 question because it's my area of work and I'm very fascinated by your research. But I will open the floor to questions and discussion so I don't abuse my role as a moderator, because I'm sure that lots of people are interested in asking you several questions. I will check the presentation. Okay, I have Harry. Harry, is your hand raised from the previous session or is it a current thing?
Yeah, sorry, I'll get rid of it.
You can ask a question if you wish.
No, that's fine. That's fine. Although it's nice to see Mesa give a nice presentation.
Thank you.
Thank you.
Thank you very much, Mesa. I see comments and people who are really thanking you for your nice presentation here. I'll check the hands raised again if I have any. If not, then I will use my time as a moderator to ask questions. Mesa, while doing this study, what were the, I'm sure that you have very well captured the perceptions of women and their plight sometimes and something, but were there any satisfactions that they showed while working the land? Did you feel at any point in time in those in-depth discussions or the focus groups why they're sticking to or they are keeping on working the land instead of pursuing another job?
Yeah, of course. Yeah, that was really clear from many of them that we interviewed. The women there in the Jordan Valley, this is the thing that they have raised doing. Like they started working in the farms with their families since they were very young. So they are used to this, and they have this feeling that this is something that they do even if they are not paid for, or even if they are not thanked for. They feel that this is something that is part of their personality and part of their life. So many of these women, especially the older ones, they were very connected to their farms, and they don't even think about going outside or doing anything else. Like for the ones who are maybe younger ones, they started thinking about doing something else and even going and working in the settlements, in the Israeli settlements, because they were very close to their neighborhoods, and they used to go there to get some paid from there. But many of them, like as I said, especially the older ones, they even don't like the other women who go out and work in other places. Like I remember one of them, she was the owner of her land, and she had workers working with her, and she was like, if anyone has a land, they need to cultivate and do and plant something. It is crazy that people leave their lands and don't do any planting. So that was like one of the things that appeared a lot among many of them.
It's the pride of the worker. It's the pride of the farmer, of the farm worker, actually, and we see it often in research when we're doing research with these participants. It's interesting that mechanization has alleviated the burden of men, but it did not so on women. Could you elaborate a little bit more on this? Because this was a very interesting finding.
Yeah, sure. Like just to note that this was like only, I'm not sure if this applies to other places, but because we did our research in the Jordan Valley, so this was very clear, because people usually they do the work as a family, so they work together, men and women together. So it was very clear that even men, because we talked to some of the men and we interviewed them as well, to get an idea, and they told us that we need to have women in the farm because these are their tasks. So they need to do this task because we are more responsible for like contacting the people to bring the stuff, or even for marketing, and also the use of the machinery. So before having the mechanization and having the technology in the agriculture, they used to have to do called dawalib, because they used to do the very simple irrigation where they had like small not holes, but like pots, small pots, where they pass the water to be distributed to different areas of the land. So that was the men's job to do that, and they spent the whole day every day to do this. So it was very heavy on them. So after they had the tractors and the drip irrigation and all these helping machineries, this decreased the burden on the men, because now they have less manual work and less not very heavy as before. But for the women, it was the opposite, because they used to do the harvesting and the weeding. Maybe for the weeding it decreased a little bit because they used more pesticides, and all these stuff decreased the weeds. But after introducing the drip irrigation, the amount of production doubled. So they needed more work on the harvesting and picking the plants, and that was the women's task. So it was more heavy on them. They spent the whole day bending, or even squatting, or doing trying to reach the plants that are vertically planted in the greenhouses. So that increased the heavy and the load of the work on them. So that was also very clear.
Thank you. Thank you very much, Maisa. This is also very clear. One very last, because we still have 1 minute, I think, before we can conclude. One very last clarification with regard to the poor nutrition, to the poor nutritional status of the women farm workers. Do you think because their consumption is focused on the crops that they work on, that they produce, they don't have a diverse nutritional intake, or is it even they don't have access to the crops that they produce? What was more obvious to you in that research?
Yeah, this depended mainly on where they worked and if they work in the family farm or not. Like, for example, if they work in their own farms, then part of the production they will consume themselves. But if they work for others, then they don't have access to the crops they work in. But the issue of poor nutrition was clear because of the heavy workload they had, especially when they are working in very large farms. So they needed to stay in the farm picking or doing different tasks for the whole day, and they barely had any break or any time to eat or to drink. Even they had dehydration problems. Exposure to the hot weather and not having even access to water or toilets, that was also another problem that we found out in the second part of the study. All these issues appeared very clearly, because many of them told us that many of the times we fainted in the farm because we forgot to eat or drink. That was also a problem that they had.
Thank you. Thank you very much for this very timely and enlightening research. I really thank you for sharing your results with us today.